Hello, I'm Katie Adams with MedCity News, and I'm here with Valerie Mondelli, the Chief Commercial Officer at DrFirst. Thanks for being here today.
Thank you, Katie, for having me.
Of course.
Pleasure.
Well, I understand that you're new to DrFirst. You joined recently, so can you tell me about what drew you there?
Yes, Katie, I'm glad you asked that question. I actually have been following DrFirst for over 2 decades, my entire career. So I've been very familiar with DrFirst. They're cutting edge. Their innovation really speaks for itself. They have really developed over the years an intelligent medication management platform that sits within the prescribing workflow and that really connects the providers, the payers, and the patients for better outcomes. I'm sure we'll talk a little bit about what that means. I was really impressed, though, when I got here to see the depth, the breadth, and the scale of which we help patients start and stay on therapy. Over 100 million patients annually interact with us in our platform, and we have over 1.5 billion scripts that have flown through our platform over the last 5 years. So certainly something that I could really get my heart and head around. I love the mission here to help patients be healthier, help providers write cleaner scripts with less back and forth, less rework. And I've always said the diagnosis initiates care, but medication really advances it. And so I'm just thrilled to be here.
Well, this medication management, medication adherence is so much more than just a set of quality ratings. It can really be a window into a patient's overall health or how they're maintaining their health. So can you talk about why it's so important and why it's a sometimes overlooked part of the healthcare journey?
Yes, I love this question, Katie. It is overlooked. And so I'm a pharmacist. I've stood behind the counter. I have watched patients. It's very intimidating to go from a medical visit to the pharmacy to get their therapy. Many are confused. Then you throw in benefit design, prior auths, all of that, and it quickly can be very overwhelming for a patient. Medical visits today, when a patient goes to see their doctor, 70% of the time a prescription is written. But 40 to 50% non-adherence in our chronic care patients. That's a lot. And guess what that means? The patient does not start therapy and they're back in the hospital. They're back in the hospital, they're back readmitted. A year later, they come back to see their physician. All of a sudden, their health has deteriorated even more. That's why it's incredibly important.
Yeah, I mean, certainly it's bewildering, especially if you have a chronic condition or when you're managing multiple medications. You can feel alone, like you have no guidance. So I definitely understand that. Well, let me ask you this before we part ways. How would you say that DrFirst delivers value for its customers?
Katie, I love that you're putting yourself in the patient's shoes. We've all been there. And it is an overwhelming experience. So when we think about DrFirst and where we sit, first and foremost, it starts with a clean prescription. So we're helping the doctor write a clean prescription and preventing the back and forth that goes on of rework. And we're also helping the doctor with less clicks. So it could be examples of the doctor has written for a quantity that's not covered by the insurance company. And it gets to the pharmacy and now it bounces back because the insurance won't cover it. It's just a simple change of quantity. So we can prompt the doctor within workflow how to write that prescription. Second could be that within workflow, the physician could go over some options for the patient around affordability options. There could be financial assistance programs that the patient wouldn't know about or the provider wouldn't know about. We can also enroll them in support programs. We can gently nudge the provider and the patient on education of that therapy, and the list goes on and on. And so we're doing, though, that right at point of prescribe, not 3 days later when the patient has left and is back to their busy lives, but we're doing it right there at point of prescribe. Then when the patient gets to the pharmacy, they've already been educated. They've already had this discussion with their doctor. They understand it's less intimidating, less overwhelming for the patient, and they've got a clean script. And so it's easy to pick up that prescription and go on about your day and to stay on that therapy. 88%. So patients on our platform have an 88% engagement rate. And they stay on our content, the content within our prescribing platform, our med management platform, for 45 seconds. So one message, we are engaging the patient, and we have seen incredible results on first fill lift, keeping the patients adherent, making sure the doctor doesn't have all that rework and all that back and forth by getting the script clean in the first place. So again, I go back to, I love DrFirst's mission. Our technology really advances the medication side. So the diagnosis initiates care, but the medication advances it. And that's where we sit. And that's why I believe that the value we bring is so important, because keeping patients on their medication and helping them navigate that medication journey is just so critical.
Yeah, that's a very critical part to making sure they get better.
Yes. Yes.
Well, thank you so much for your time today. I hope you enjoy the rest of the show.
It was a pleasure. Thanks for having me.